Hi everybody, this is Dr. Ravindran Kumeran from Apollo First Med Hospitals in Keel Park. In today's topic, I'm going to discuss about the bile duct, the emergencies which are associated with somebody's bile duct. Often people don't realize what a bile duct is. Bile duct is a tiny tube which connects the liver to the intestine. So the liver produces bile and the bile is transported through this tiny tube, often 4 to 5 millimeters in diameter. It's a short tube which connects the liver to the intestine, and the gallbladder virtually hangs off the bile duct, right? It's like a mango hanging off a branch, right? So these bile ducts can sometimes trigger off infections referred to as cholangitis, which is the worst form of sepsis somebody can undergo, right? It is in par with the urosepsis, meaning infections associated with the kidney. People can become sick very, very rapidly from being relatively normal to requiring admission in ICU, intubation, meaning requiring to be on the ventilator, requiring multiple supports for various organs. So cholangitis is the infection which can happen in the biliary tree, meaning the process, the liver through which the bile duct, there are plenty of tiny little bile ducts which all cohesively come out as the bile duct. So why does somebody get cholangitis? Any system in the body, if it gets affected, any system for that matter, you have pain and immediately you also have an infection, right? So things have to be moving, whether it is even tears, the lacrimal duct, if it gets blocked, it is troublesome. Any system has to be functioning continuously to avoid infection. So when there is a blockage within the bile duct, often because of simple gallbladder stones, there is back pressure onto the liver and toxins tend to get accumulated and becomes a fertile breeding ground for bacteria to flourish. So when you have bacteria within this closed compartment, it kind of spreads to the general bloodstream, and that causes severe fever, often rigors where the patient is shivering, and is often associated with jaundice. So this triad of fever, rigors and jaundice is referred to in medical terminology as a Charcot's triad, and patients need to be in a hospital environment, have to be on IV antibiotics, and the biliary system has to be immediately opened up. So they often require either a radiologist to put in a tube to decompress the system or an endoscopist to open up the biliary tree. So in other words, the blockage, the stone has to be removed so that the patient's system is cleared up of all infections. This often happens in elderly patients, diabetic patients. These are the vulnerable groups which go on to form cholangitis, and if it is not treated appropriately, can be life-threatening, often giving rise to multiple abscesses in the liver. So you come across patients who've developed multiple, several different abscesses within the liver itself, making the patients very sick, requiring prolonged hospitalization. So as a rule of thumb, elderly patients, as I've said in the previous video, if they have gallbladder stones, I think they should electively have their gallbladder removed so that they do not develop one of these life-threatening severe complications requiring a hospital admission, which can be very prolonged and very tedious for them. Thank you.